Kim speaking from 10 Sigma. Welcome to episode 124 of Transition Tuesday. Today I'm going to talk about transition for students with other health impairments. Right now I'm going to switch over to a short slide presentation to share this information. Transition for students with other health impairments. Transition Tuesday, episode 124. In today's video, I will be discussing the 3 biggest challenges for students with other health impairments transitioning to adult life, and some suggestions to help with these challenges. Before we get into the challenges for students who have other health impairments, let's talk about the definition of other health impaired under IDEA. Other health impairment means having limited strength, vitality, or alertness, including a heightened alertness to environmental stimuli, that results in limited alertness with respect to the educational environment. That 1 is due to chronic or acute health problems such as asthma, attention deficit disorder, or attention deficit hyperactivity disorder, diabetes, epilepsy, a heart condition, hemophilia, lead poisoning, leukemia, nephritis, rheumatic fever, sickle cell anemia, and Tourette syndrome. And 2, adversely affects a child's educational performance. The 3 biggest challenges for students who are other health impaired transitioning to adult life are healthcare, including transitioning to adult healthcare, resources and support, employment, and advocating for self. Let's talk a little bit more about these 3 challenges. For the first challenge, health, resources, and support, we all know that health affects everything in life, including employment, education and training, and independent living. Young adults, especially students who have a health impairment, need to know how to manage their health and healthcare needs, and they need to know how to transition to adult healthcare. In order for them to do this successfully, they need to know about their disability and their health problems. They need to know about preventative and maintenance health care, including natural health care and alternative medicine. They need to know how nutrition, exercise, and stress management affect their health. They need to understand health insurance. They need to understand about medication, specifically their medication, when to take it, and what side effects it may have. They also need to know how to find reliable providers, resources, and supports so they can make informed decisions about their healthcare needs. The second challenge for students who are other health impaired is employment. Only 35.9% of people with a disability were employed in 2016. The specific employment rate for people with health-related disabilities is unknown because of the complexity on how to measure it. But students with other health impairments need to understand how employment can affect their health condition. According to the Lead Center's 2015 policy brief, employment has shown to have a positive effect on social, psychological, and financial benefits that improve health. On the other hand, employment can negatively affect a student's health if it is too difficult mentally and or physically for their health condition. Other things that students need to consider are the accommodations they need at their employment. Will they be lifting, walking, sitting, standing, the number of breaks they need, the number of hours they're going to work, the time of day, working in the morning, working at nighttime, or overnights can affect your health. Is it going to be full or part-time? And they also need to consider the atmosphere and the working conditions. And the last challenge is advocating for self. Students need to learn about their disability, health and self-care needs, their rights, especially IDEA versus ADA and Section 504, and the accommodations that they're going to need. Students need to practice to effectively and assertively communicate their needs and preferences. And students need to learn to ask questions if they don't understand or if something is not clear. Here are some suggestions for help improving students with other health impairments post-school outcomes. Teach students to take ownership in their transition process. These students need health care included in their transition IEP. For more information on how to do this, please visit Transition Tuesday, episode 30. Students need to learn about their disability, health needs, IEP rights, and accommodations. Help students make a list of resources and supports, especially healthcare providers. For suggestions on helping students make this list, please refer to Transition Tuesday, episode 81. Teach self-advocacy skills. This topic was covered in Transition Tuesday, episode 14. Give students many opportunities to discover and explore their interests, employment, and post-secondary education options through assessments, activities, and tasks. Teach social skills, including soft skills, and try to get the student involved at school or in their community. Get parents or families involved in the transition process, and have the student volunteer and or participate in a work-study program if possible. For today's bonus, I'll be sending you information and resources to help students who are other health impaired transition to adult life. Thank you for watching the video. I hope you use this information to help your students. Be sure to check your email for the bonus we just sent over. If this is the first time you've ever seen an episode of Transition Tuesday, click the link below to receive the bonus. Be sure to like and share the video and leave a comment or suggestion for a future episode of Transition Tuesday. Have a great week. See you next Tuesday.